You absolutely can figure out who, but again, especially in the business world, and that can channel down into,
Yeah.
cronyism, where you only have people that you bring in who will, worship you, honor you, support you, lie for you, cheat for you, steal for
Right.
you, right? You know what I mean? I'm actually, anybody who knows me knows that I despise opt-out programs,
Hmm.
because I'm like, they
Yeah.
should all be opt-in programs.
All of them.
You should be required to convince me to do whatever this thing is, and
Right.
not force me to take an action against my will to opt out of this thing. Well, that's an avenue of control. Whoever is in
Yep.
control of the single health payer, whoever's in control of that single payer health plan is in control of all
Well,
healthcare, right?
and
And
anybody who's familiar with economics, understands the idea of the tragedy of the commons, right? Where the park, that supposedly everybody's supposed to take care of, nobody ends up taking care of it.
Mhm.
And that's what, when you have any kind of program like that, it becomes corrupt, and it becomes dilapidated, and becomes, and I think one of the tragedies in our healthcare system that I'm seeing right now, and you can correct me if I'm wrong about this, but I think one of the great tragedies is that doctors don't have individual autonomy anymore. They're employees of insurance companies, or
Mhm.
employees of major companies that are largely beholden to the government.